दोस्तों, आज का सवाल इमेज बेस्ड है। मेरे प्यारे FMGE नीट PG स्टूडेंट्स, आज मेरा पिक्चर एक बहुत ही सीनियर साइंटिस्ट के साथ है। मेरा सौभाग्य था कि इनसे मिलने का मौका मिला। आप लोगों को मैं बताऊंगा। तो ये हैं सीनियर साइंटिस्ट हैं हराल्ड चूर हॉर्सन। ये डॉक्टर हॉर्सन हैं, डिस्कवरी दैट कॉजेस सर्वाइकल कैंसर। ये हैं नोबेल प्राइज विनर हराल्ड चूर हॉर्सन बहुत ही जीनियस पर्सनालिटी। मुझे इनसे मिलने का मौका मिला और बात करने का भी मौका मिला, और इन्होंने मुझे समय दिया। मैं इनके साथ 4-5 मिनट बात कर सका और बहुत ही अच्छा लगा। नोबेल प्राइज विनर जो होते हैं रियली बहुत जीनियस होते हैं, स्पेशली ये सीनियर साइंटिस्ट हैं, जर्मनी के हैं। तो ये नोबेल प्राइज विनर इन फिजियोलॉजी एंड मेडिसिन 2008 हराल्ड चूर हॉर्सन। ये मैं इंफॉर्मेशन विकिपीडिया से लिया हूँ, आप लोग भी सर्च करके देख सकते हैं। ये जर्मनी से हैं, लेकिन दुख की बात यह है कि 2023 में इनकी डेथ हो गई। मैं इनसे मिला हुआ हूँ और ये बहुत फेमस हैं। ये नोन फॉर डिस्कवरी दैट HPV कैन कॉज सर्वाइकल कैंसर। सर्वाइकल कैंसर पे इन्हें अवार्ड भी मिला है, नोबेल प्राइज भी मिला हुआ है। वायरोलॉजी के फील्ड में इन्होंने अपना साइंटिफिक कैरियर स्पेंड किया है। इंस्टीट्यूशंस जो इनका है, जर्मन कैंसर रिसर्च सेंटर, यूनिवर्सिटी ऑफ हाइडेलबर्ग। तो मैं इनसे पर्सनली मिला हूँ, जो मेरा पिक्चर आप देख सकते हैं यहाँ पे। मैं इनसे पर्सनली मिला हूँ और बहुत अच्छा लगा ऐसे पर्सनालिटी से मिलकर। अवार्ड भी इन्हें बहुत सारा अवार्ड मिला हुआ है, अर्न्स्ट यंग प्राइज, प्रिंस माहिडोल अवार्ड 2005 में मिला है, 96 में मिला है। नोबेल प्राइज इन द फिजियोलॉजी और मेडिसिन 2008 में मिला है। तो मैं इनसे मिला हूँ और HPV के बारे में, इन्होंने सर्वाइकल कैंसर पे इनको नोबेल प्राइज मिला है। तो आज आज का जो टॉपिक है HPV infection caused by a DNA virus from papillomaviridae family. Many HPV infections cause no symptoms and 90% resolve spontaneously within 2 years. Sometimes HPV infections persist and result in warts or precancerous lesion. Many warts are caused by HPV. These lesions, depending on the site affected, increase the risk of cervical cancer, cervix, vulva, vagina, penis, anus, mouth, tonsils, or throat. Nearly all cervical cancer is due to HPV, and especially two strains, that is HPV16 and HPV18. Actually, two strains account for 70%. Two strains account for 70% of all cases. HPV16 alone is responsible for almost 90% of the HPV related cancers of mouth, throat and tonsil. HPV16 is responsible for almost 90% of the HPV related cancer of mouth, throat and tonsils. Okay. Between 60 to 90% of the oral cancers listed above are also linked to HPV. HPV6 and HPV11 are common cause of genital warts. HPV6 and HPV11. HPV6 and 11 are common causes of genital warts. Okay, and laryngeal papillomatosis. Okay, so come to the point. Types of HPV. Okay, types of HPV types and associated disease. Okay, these are the HPV types. HPV1 causes foot warts. HPV1 causes foot warts. HPV1 causes foot warts. HPV45 cervical cancer. This is very important. HPV45 cervical cancer. HPV18 also cervical cancer. HPV6 genital ulcers, which I already told you before, 6. HPV11 also genital ulcers. HPV31 cervical cancer. HPV16 cervical cancer. HPV2 hand warts. Okay, so come to the point. HPV types. HPV types. These HPV types and associated diseases. HPV1 foot warts, HPV45 cervical cancer, HPV18 cervical cancer, HPV6 genital warts, HPV11 genital warts, HPV31 cervical cancer, HPV16 cervical cancer, HPV2 hand warts. Okay, let's come to the another point. Major capsids protein L1 पेंटामर HPV11. सो ये इसका इमेज है HPV11 का, हाउ इट लुक्स लाइक. ओके, प्रोटीन L1 पेंटामर HPV11. Come to the another point. A structure of the HPV type 16 viral capsid protein. How it looks like? Okay, how it looks like viral capsid protein. See how it looks like. Capsid protein viral 16, HPV16 viral capsid protein. It looks like this. Okay, come to the another. A structure of the HPV16 oncoprotein E6 purple color obtained by X-ray crystallography. So ये है HPV16 oncoprotein E6 purple as obtained by X-ray crystallography. Papilloma. So हम लोग पैपिलोमा के बारे में जानेंगे कि पैपिलोमा, what is papilloma? Okay, what is papilloma? Try to pay attention. Why papilloma appears and how to treat them. Papillomas are non-cancerous growth that can develop on your skin or mucous membrane. They rarely turn cancerous but can cause problem if they grow large and press on healthy tissues. When papilloma develop on your skin, they appear as wart. Or skin tags. Okay, a skin tag. Okay, the skin tags. Location they can develop include your lips, mouth, eyelids, tongue, throat, cervix, genitals, causing genital warts. Most of these papillomas are contagious through physical contact except for skin tags. Genital warts are usually transmitted through vaginal and anal or oral sex. Do papillomas have any symptoms? Papillomas signs and symptoms can vary depending on where papillomas develop. Warts, okay, warts that develop on your skin may appear as a small or raised bump, that may have irregular, irregular, irregular surface, okay. Bleeds, if you touch it will bleeds, okay, bleeds. Or itch, it will be itching. Occur in clusters, okay, occur in clusters. How papillomas treated? Some papillomas may require surgical removal, cryotherapy, or other treatment modalities. About 80% of the people clear an HPV infection without treatment within 18 to 24 months. Okay, so these are the information about the papillomas. This is ectropion or entropion. This is ectropion or this is entropion. This will come to your exam. Ectropion images. Ectropion means eyelids rolls out. Eyelids rolls out. Eyelids rolls out. Entropion, eyelids rolls in. See, eyelids rolls in. Eyelids rolls in. Okay. So these are very important questions for your exam. Left lower lid retraction. Left lower lid retraction. Okay, that is. This is fissure ring. This is fissure ring. This is fissure ring at the base of the keratoconus. This is Munson sign. This is Munson sign in the keratoconus. Munson sign is a V-shaped. Munson sign is a V-shaped. Indentation observed in the lower eyelid, especially it is present in the lower eyelid. Patient's gaze is directed downward. First criteria is V-shaped. Second is patient lower lid. It is present in the patient's lower lid, not in the upper lid. Second, the gaze is directed towards downward. Okay. So this is see V-shaped. See V-shaped and present in lower lid. This is irregular. This is irregular keratometry KC at the placido disc L, this one, and pentacam right. This is okay. Placido disc. This is placido disc. This is placido disc. This is placido disc. Okay. This is placido disc. Okay. This is placido disc and pentacam. This is right side. This is right side pentacam. Okay. This is pentacam. Walked astray in keratoconus. Vertical stress lines in descemet membrane. Okay. This is present in the descemet membrane. Okay. This is present in the descemet membrane. This is present in the descemet membrane. Normal pentacam. This is image of normal pentacam. It will come to your. This is normal pentacam. See, normal pentacam. It will come to your exam. This is the instrument, how we measure it. Okay. This is fungal. This is fungal keratitis. Fungal keratitis. Feathery margins, fixed hypopyon, feathery margin. See, feathery margin. This is feathery margin, and here is available feathery margin. Okay. Herpetic dendritic keratitis. Herpetic dendritic keratitis. Herpetic dendritic keratitis. Okay. Leading cause of corneal blindness worldwide. Okay. Leading cause of corneal blindness worldwide. Okay. See here. See here. Okay. Typically, patients with the HSV keratitis present with blurred vision, photophobia, pain, redness, and tearing. Ocular pain is often hallmark HSV epithelial keratitis, as it tends to be the most painful form of HSV keratitis. Okay. How we manage? Primary HSV epithelial keratitis usually resolve spontaneously. However, treatment with antiviral medication does indeed shorten the course of disease and may therefore reduce the long-term complication of HSV. This is very important, herpes zoster ophthalmicus, HZO. Predicting significance of the Hutchinson sign, HS, or nasociliary nerve involvement, okay, or short name is HZO. Okay, you can see the image, okay. Acanthamoeba, this is acanthamoeba ulcer, ring shaped, it is ring shaped, and perineural keratitis, ring shaped, perineural keratitis, ring shaped, see, ring shaped, okay. Acanthamoeba ulcer, ring shaped, perineural keratitis. This is very important information. Salmon patch, interstitial keratitis, bleeding in stroma, see, bleeding in stroma. This is a specular microscopy by which a specula count can be measured. This is normal, polymethism +1 Gattata or low cell count. Least nodule. This is least nodule seen in NF1 greater than 95% patients. Least nodule. This is least nodule. Okay. See, least nodule. This is Wilson disease, which is very important for your exam. Wilson disease, copper deposition in the Descemet membrane. Sometimes you also ask which membrane, Descemet layer in corneal ring, that is also called calf ring. See, here is given arrow. Most peripheral degeneration, lipid deposition in limbus, that is called arcus senilis. That is called arcus senilis. See, arcus senilis. This is called arcus senilis. This is called arcus senilis. Okay. This is a very important test, that is Schirmer test. It is for dry eye if less than 15 mm, weighting positive. Okay. So see, Schirmer test, Schirmer paper. Okay. This is sealed ulcer. This is called sealed ulcer, or also called VKC. Superior half is involved. Vernal keratoconjunctivitis. See here. This is limbal VKC. See, Here limbal VKC. Limbal, see here, limbal VKC. Limbal VKC and cataract, steroid induced cataract or 4 weeks post cataract surgery, OS. Limbal thickening, 6 months post operative after stopping treatment, sealed ulcer or limbal thickening. This is called Horner-Tranta. This is called Horner-Tranta spots in the VKC. Gelatinous, it is gelatinous in nature, thickened or opacified mucoid nodular infiltrates of the eosinophils in and epithelial debris. See, Horner-Tranta spot, see, Horner-Tranta spot, see, Horner-Tranta spot, see, Horner-Tranta spot in VKC. This is cobblestone papillae. This is cobblestone papillae. Huge papillae in VKC. See, cobblestone papillae. This is huge stone. See, like a stone. Cobblestone papillae. See here. This is Artel's line. This is Artel's line. This is Artel's line. Conjunctival scarring. Artel's line. Conjunctival scarring, Artel's line, see. Flytenular conjunctivitis. PKC, especially short form is known as PKC. PKC is a nodular inflammation of the cornea. Nodular inflammation of the cornea or conjunctiva that results from the hypersensitivity reaction to the foreign antigen. See. Hypersensitivity to the foreign antigens. See? This is very important. Subconjunctival hemorrhage. Subconjunctival hemorrhage. See, subconjunctival hemorrhage. Subconjunctival hemorrhage. See, subconjunctival hemorrhage. See, subconjunctival hemorrhage. Collection of the blood beneath the conjunctiva. Collection of blood beneath the conjunctiva. First point, important point. What is the cause of conjunctival hemorrhage? First is the injury. Second is retrobulbar hemorrhage. Third is hypertension, is one of the most important cause. Fourth is bleeding disorder. And treatment. How to treat? How to treat conjunctival hemorrhage? Observation. Absorbs spontaneously 2 to 3 weeks. Okay. My dear friends, thank you very much. Thanks for watching. Like, comment, subscribe. If you like it, please give your comments or give your feedback so that I will try my best to improve and bring different types of questions for you people. I need your help. Please give me your feedback. I need your feedback for more and more updates. Thank you very much. Class is over now. Take rest. Bye bye.